Hi everyone, a very warm welcome wherever you are. Good morning, good afternoon. My name is Megan Deeney. I'm the technical manager for this session on resilience, vulnerability, human and planetary health, which will be chaired by Mark Lundy. Thank you for taking part in ANH 2022. And we look forward to a really robust and interactive session today. Thanks very much. And over to you, Mark.
Okay, thank you so much, Megan. It's a pleasure to be here with all of you today. Good afternoon, evening, morning, wherever you are on the globe. Today we have a very exciting session entitled The Resilience, Vulnerability, Human and Planetary Health. We have a range of exciting speakers that I will go through quickly. The idea here is that we'll have a total of 6 presentations. We'll take a short break after the first 3 for any clarification questions and then proceed to complete the session with the second 3 presentations. And we will have a Q&A, general Q&A session at the end. And as Megan has indicated, please be sure to put your questions into the chat box. So today we have with us Annette Adong from the University of Bonn in Germany and Makerere University in Uganda. She'll be speaking about using high frequency data to validate resilience metrics for food security amongst COVID-19 and women dietary diversity in Uganda. Then we have a presentation from Melody Matre-D'Hotel from CIRAD in France. And she'll be talking about assessing local food systems resilience in conflict afflicted areas. Then we have a presentation from Vincent Alulu from the International Livestock Research Institute in Kenya, talking about livestock forage availability and nutrition security in drought-prone northern Kenya and southern Ethiopia, evidence from crowdsourced high-frequency panel survey data. And then we'll take a break and move into having clarification questions, and then move into the final 3 presentations from Naomi Saville from the University of College London Institute for Global Health in Nepal, measuring the contribution of pollination to diets and climate change impacted mountains of Nepal. Dr. Christian Reynolds from the City University of London, speaking about the comparison of greenhouse gas databases using food X2 codes. And then finally, Lilia Lishanaka from the University of Edinburgh in the UK, speaking about pesticide exposure and child growth in low and middle income countries, a systematic review. So without any further ado, I'd like to hand over the space and the microphone to Annette. Annette, if you could please take us through your presentation. Remember, we have about 7 minutes or 8 minutes for each person, so I will try to keep track, and I would appreciate if you could stick to the time. Thank you so much. Annette, over to you and welcome.
Thank you so much, Mark. As introduced, my name is Annette Adong. And I'll be talking about using high frequency data to validate the resilience metrics for food security amidst COVID-19 in Uganda. I'm from the Center of Development Research, a postdoctoral student from the Center of Development Research, University of Bonn, and an Imana Fellow round 6. So by way of introduction, resilience, by definition, resilience is the ability of households to withstand shocks and stressors, to maintain a certain level of well-being based on the available options for them to earn a living, but also to handle risks that emerge. However, given its unobserved nature, many discussions in literature, because of its unobserved nature, many discussions in literature have centered on, suitable approaches for its measurement. So, so discussions have centered around, how, the use of, proxy indicators to represent, the construct of resilience, which is very dynamic, but also very complex in just, its understanding. And then also the fact that, to what extent can we use static approaches to measure, a dynamic concept like, like resilience. And then some methods have also been tagged as, being very academic and data are demanding, but also importantly, literature has emphasized the use of, qualitative methods to back up or to be used integrate, to be, integrated with quantitative methods. So the metrics that we try to validate in this study is a resilience index measurement and analysis, matrix. So this was introduced by the Food and Agriculture Organization, and it was used in, Palestine and Kenya. But in 2013, this RIMA approach was upgraded to RIMA 2 by basically delinking the food and nutrition security from the resilience capacity. So many studies have, of course, relied on the RIMA-2, that's the Resilience Index Measurement and Analysis Matrix in the context of Uganda, Tanzania, Senegal, Mauritania, Lesotho, and the Gaza Strip. Beyond the RIMA-2, there are also, other analytical approaches, such as, the subjective self-evaluated resilience score. I think this is also, this mainly bases on, subjective measures of estimating resilience, but also other approaches have used, factorial analysis of observable measures to measure, the resilience index. But importantly, most methods also apply qualitative assessments, using, focus group discussions to understand the concept of resilience. So the objectives of our study, like I stated before, we try to validate this RIMA-2 approach. And validating this sense means, trying to see if RIMA-2 can be used accurately to measure resilience using high frequency data. So maybe the question is, why emphasize the use of high frequency data? It's because most of the studies in literature, or almost all the available studies that have used RIMA-2 have only used the annual data set, like the annual recall period for the different pillars of RIMA. But for this study, we try to see if also RIMA-2 can be accurately used to measure resilience for using high frequency data collected between 2 to 3 months within a year. Because from the very fact that within a year there could be several changes, several shocks, and several coping mechanisms that the households adopt to. And even within this period, we can see some bit of recovery. So I'll explain further why it's also important to see that RIMA-2 can approximately be used to measure resilience, but also the changes within a year. So we try to corroborate the resilience measured, using RIMA-2 with the resilience measured or resilience capacity measured using the subjective measures of resilience that I had stated before, but also try to compare it with qualitative assessments that we get from focus group discussions and from key informant interviews. A secondary objective is also to examine the factors that affect resilience within the year, but perhaps for this presentation, I'll mainly focus on trying to validate the RIMA-2. This is a conceptual framework. So ideally, what this conceptual framework tries to show is first, that there might be some resilience changes between periods, between a short time span of 2 to 3 months within a year, but also that in the construct of the RIMA we have pillars that might not be observable but can be constructed from observable variables. And these pillars include access, access to basic services. Generally, these observable variables like, distance to markets or to infrastructures could help explain this. But we also have, the asset pillar, the social safety net pillar, and the adaptive capacity pillar. Within the RIMA estimation, we incorporate the fact that, there will be some coping strategies that households will adopt, but also that, importantly, that, resilience might change within these short periods of time. And we are going to see if RIMA-2 can be used to measure this. So descriptive statistics generally from our webs, so we collected data in almost 6 times within the year. Already we see that there was, variation in, we see already that, within these periods, there are changes in shocks that households are exposed to. For example, if you see wave 1, that's the first bar, and the last bar, you see that drought and heat waves stand out as, it's some of the key shocks that affected households during this time. But other shocks also include unusually low prices of agricultural commodities and irregular rains, floods, but also maybe it's not shown in this graph, but other shocks such as death of household members also do appear. But at the same time, in the next graph, we see how households then try to cope to some of these shocks that they're exposed to. Of course, to some extent, and that's the blue, some households will just not do anything to cope with, the shocks. But other coping mechanisms include, getting help from, from relatives, but also, selling off their assets, both productive assets, but also, consumption assets, relying on savings, and maybe eating lower quality foods. That's when, shocks that affect nutrition. So here we try to now see from the pillars of the RIMA2, do we see any significant differences between, waves? Remember, wave 1, we collected it around, June. This is a survey that we collected around June, July, and then wave 3 we collected it around December. So within the 4 pillars of the RIMA2, do we see any significant differences between the waves to actually illustrate that there could be some mechanism at play within the households in regards to their exposure to shocks, but also their coping mechanism. So here we see, for example, that, the first one is access to basic services. We see significant differences between wave 1 and wave 3, but also the asset pillar, which is the second one, and the adaptive capacity, that's the third, and then lastly, social safety nets. So between wave 1 and wave 3, we're already seeing some components of the resilience matrix actually do changing. So that's the same with panel B. We also see some changes, and lastly, also panel C. But why we don't include other survey waves like wave 2, 4, and 5 is that they're not so different. Like wave 2 is not so different from wave 1, so is wave 4 and 5 from wave 3 and wave 6. So we only chose these particular 3. So I think importantly, this is just estimates of the resilience metrics, and we're just showing a positive association between the components and the resilience capacity indicated. But maybe to wrap up is importantly, are we seeing any changes in resilience across the waves? The answer is yes. So between wave 1 and wave 3, there's a significant difference, but there's no difference between wave 1 and wave 6. So we do a sensitivity analysis test, which is consistent with our findings. That's when we construct the RIMA wave in a different way. But maybe just to corroborate what our findings with a subjective measure, we also see some overlap. So the subjective measure, the approaches are quite different from RIMA. So this is where you just ask households, to categorize, to give us, their feel with the resilience dimension. So for example, this question, I think it's very important. I'll just go through it. So for example, we ask households, if a heavy flood or drought occurred in your area tomorrow, would you be able to fully recover from this? So by asking this question, we are able to estimate their coping capacity. So that is a subjective measure that we use for, for measuring resilience. And when we compare it with our resilience.
Annette, I'm so sorry to interrupt you. Thank you so much for a fantastic presentation. We're going to have to move on to the next one now, just to leave time for Q&A, but I'm sure people will come back to you.
Okay, thank you. Thank you so much for the presentation. Let's move on to Elodie. Elodie, over to you.
Hello, everyone. My name is Elodie. I'm an economist at CIRAD, and I present you an ongoing work on the food system's resilience in conflict-affected areas. This is a joint work with my colleague Chris Benet, who's here, from SIAT, with people from the World Food Programme as well. So basically, the empirical justification is that most of the people that are in acute food insecurity, they are living in conflict-affected countries. And in the literature, there are some empirical work on the effect on the conflicts on the agriculture. Like we know that the lands are abandoned in those countries, in those conflict-affected areas. We know that there is a shift towards diversified agriculture because it's less risky than to rely on the markets. We know that tends to be a livestock decrease and a shift between the big animals towards smaller animals. And mainly the main idea is that the agricultural production is going down and the incomes as well. So it has been documented in the literature. And on the other side, there is a documentation as well on the effects of the armed conflicts on food consumptions of the individuals on their households. So like studies on the HFIAS, studies on the dietary diversity of the individuals, And those changes in consumption are related to higher prices on the markets and to income shocks, because people cannot stand anymore, maintain their economic activity. And yes, there is some paper in the economic literature are very cautious about the endogeneity issues if we relate food security to armed conflicts. What is explaining what there is a bunch of literature on this. But the starting point of our activity or project in Burkina Faso, it's that we don't know much about what's happening in the middle between the producers and the consumers, and about how the food systems are impacted by the armed conflicts. So this is our topic. And what we are looking at is the way those different food systems are impacted, and we are working on the heterogeneity of this impact, because what we see is that some people are maintaining themselves into their economic activities, while others are not, and we think that the resilience concept is a useful lens for such a topic. So this is a conceptual schemes to relate the occurrence of conflicts to the food security of the peoples that goes with the functioning of the food systems. So depending on the nature, on the frequency, on the intensity of the conflicts, operators of the food systems may be directly impact and indirectly as well, because there are some ripple effects, and indirectly because they may take some time to change their economic activities. And at the end, this relates to the capacity of the individuals to ensure their food consumption. So what we are working in the Yaga province in Burkina Faso. This is at the northeast of the country. This is close to the border with Niger. And what's happening in this province? There are a very high increase of violent events. So the first graph is on the increase of fatalities in 2020-2021, and we see that it's a large increase. And indeed, it was related to one very violent attack that happened into the Solon department. So the second graph is on the repartition of the fatalities according to the 6 departments that are within this province in Burkina Faso. And this is correlated with the increase of the violence events that were identified by the athlete. So those events may be related to clashes, to some looting, to some kidnappings. So there is a diversity of violent events, but it's basically the idea is that it's increasing. And the World Food Programme, they had information on the fact that since the beginning of the year 2020, it was increasing, and we should carry some exploratory work there to understand what's going on. So what we did is basically we relied on 2 surveys. The first one was led in last year in September, and the second one in November. And we had interviews with producers, processors, transporters, and traders. And at the end, we had a total number of around 300 people. And we had a high attrition in between the 2 surveys. And we don't know, as we couldn't go into the field and we had to rely on face-to-face interviews and phone surveys, we don't know much about what is this attrition related to, but one explanation may be that those people have been displaced and moved into another region. So what we did is that we surveyed those people on their exposure to conflicts and their characteristics and their food and their economic activities, and we measured the quantification of their activities in one year. So this was a recall surveys, like what were you doing 1 year ago and what are you doing now? So we came to quantification of the changes of an average 50% of decrease of the activity, but this average is hiding a high variety between the people. So for the producer, we see that on average the cultivated area, they dropped from around 4 hectares to 2.2 hectares. Millet productions high decrease as well, and we had this situation where we saw that the decrease in agricultural production is higher for the crops that are connected to the markets, while the crops that are related to the self-consumption, the decrease is slightly less. But still, it's quite an important decrease in only 1 year of observation. And a decrease in the cattle as well. We haven't any results on the substitution effect between big livestock and smaller species. On the processors, this is the same, like the people, they transform less products, and the number of their clients have fallen down. The transporters, it's quite interesting because it looks like it's the operators that are mostly impacted by the conflicts. And if we look at some indicators as the average distance they tend to travel each week, this indicator has fallen down a lot significantly in 1 year. And the traders, a lot of indicators are showing that the activity is slowed down, but some of them are maintaining their activity. And this may be related by the fact that in the secondary town, the small towns, there is a lot of displaced people that come, and those people need to access food. So we do have different indicators for the different operators, and we have been working on the common indicator amongst those operators, that is the working hours per week people are involved into their activity. So on average, we see that there is a decrease of around 20 hours a week of working, but we have been developing an econometric model to explain the decrease of the working hours. So our main
Elodie, if you could just get to the conclusions, please. We're running out of time. Sorry.
So we had intuitions on some items that could be work as mitigating effects, like being rich or having a high network. And what we came to is that effectively having a large network is having mitigating effects on the decrease of the working hours, but being rich seems not directly linked to such a mitigating effect. And indeed, it looks that the people that are richer were the most impacted. So maybe because they are more targeted by the attacks, we don't know much. We are still in the process of interpreting those figures. Yes, basically that's what we are working on, and we are very pretty much convinced that we need to understand why some people are able to maintain themselves into their economic activities, and the next steps will be to work on the specific interventions that could be implemented with the World Food Programme to maintain those people into their activity and to assess the impact of such intervention. This is an adaptive research because situations are evolving, our partners are changing their ways, like the World Food Programme is changing between food aid to cash transfer. So we are working on that process.
Thank you so much, Elodie. I think that's very, very clear. Thank you. So let's move on to the third presentation. So Vicente, over to you.
So my name is Vincent, and I work with the International Livestock Research as a researcher. We are stationed in Nairobi, Kenya. So together with my colleagues, that is Kelvin, Shikuku, Watson, and Ruksha, we are looking at the pathways of transmission of drought risk to the pastoral households in the northern Kenya and southern Ethiopia. So we know that the pastoral communities in the whole of Africa are really affected by many shocks, but climatic shocks, specifically drought, remains the most severe. And in the northern Kenya, we see that almost 50% of losses that are experienced in livestock herds are caused by drought. And then, when this happens, poverty rates, of course, increase. Food insecurity is also on the rise, and then malnutrition sets in. And then there have been so many efforts by development partners who are trying to address vulnerability in these fragile settings. And they emphasize so much on the need to use accurate early warning information. My colleague Banerjee has also been working on this kind of research. But even as they look at these fragile settings and emphasize the need for early warning systems, we realize that mechanisms of drought risk transmission to households are not well known. What we know is the direct impact of maybe drought to things like health in terms of mid-upper arm circumference, as done by some researchers. Those minute links that we can attribute to drought risk are not well known. So in this work, we have a set of objectives. So what are we looking at? One is to examine the spatial and temporal dynamics in milk production among households. We are also looking at temporal dynamics in forage suitability and the rainfall availability among these households. We also assess the relationship between rainfall availability and forage suitability. Forage suitability, in this case, we are talking about forage which is suitable for livestock that are good for producing milk. In this regard, we are talking about grazers, that is cattle and sheep. Another objective we look at is assessment of the impact of forage suitability on milk production, consumption, and dietary diversity. So we are asking ourselves, when forage suitability in terms of forage being good for livestock, does it impact positively on milk production? Does it lead to more milk being produced at the household level? And do we see an increase in consumption of milk and also dietary diversity? So in terms of data and methods, how do we go about it? We are collecting our data from 2 countries, which we are calling zones, that is Kenya and Ethiopia. In Ethiopia, we are collecting our data from the southern region, and in Kenya, we are collecting it from the northern region, which is Marsabit. And then each of these 2 countries is further divided into sentinel clusters, and each cluster and then gives a sample of 8 households. Now, what is the inclusion criteria in this sample? We require that each household has some ownership of livestock, and each household has also a child who is under the age of 5 for the purposes of collecting data on the mid-upper arm circumference for children. For the data that we are using for our research, we've collected data for a long time, starting the year 2018. But for this work, we are considering data over a period of 52 weeks. That is starting in March, the year 2021, and then to April this year. And we are using a crowdsourcing approach, which is simply, we call it CASNet, but it's simply an Android phone application that we are using short surveys that have been time and space constrained to collect information from these areas. And then we use some descriptive analysis to examine trends in the key variables of interest. In this case, we are talking about production of milk and also consumption of milk, as well as things to do with forage suitability and also rainfall availability. And for estimation purposes, we use a fixed effect instrumental variable estimation, simply a 2-stage least square estimation model for the panel data that we collect. And we are doing this to assess the effect of forage suitability on milk production, as well as consumption, dietary diversity. I will quickly go over our estimation formula. I think it's quite simply explained here, where we have the outcome variables, those are the Y's. And in this case, we have the milk production, we have consumption, and we also have aspect of dietary diversity. And then we have a vector of variables that we collect, but in our research, study, we are including the covariate as the forage suitability. And then we use rainfall availability as an instrument for forage suitability for milk producing grazers. So in prima facie, we observe some aspects. I'll just mention a few. In terms of the mid-upper arm circumference, among all our households, we observe some kids who have moderate acute malnutrition. That is an overall percent of 10. But these ones are concentrated. If you look at the space distribution, this percent is concentrated in the areas in Ethiopia. And then we look at aspects of just milk production and consumption in passing. We are seeing that most of these households really depend on milk based on what you are seeing, the high numbers. For example, consumption of milk among women is going to the north of 60, and among children is going even to the north of 70. So this affirms that milk is a mainstay in their diet, and among children, it also reminds us that in times of drought, when the drought is hitting hard, most of the households will prefer that children take milk. And that's why the consumption among children is so high. In terms of trend, we observe some trends, and the most interesting aspect here is that when rainfall availability is falling, also aspects of milk consumption and production are also falling. And when the rain availability is rising, also forage suitability will rise, and also consumption of milk products will go up. Now, because we are using a two-stage instrumental variable approach or an IV approach, we have our first stage, and our first stage has to be valid for us to apply this methodology. So in this table, we just demonstrate that our instrument, which is rainfall availability, is actually valid based on its high statistic that is significant, that is the F value. And for sure, rainfall availability is increasing forage suitability for grazers. And if you look at its start, a 1% increase in rainfall availability will lead to around 0.38%, which is commendable for these kind of setups. And this statistic is significant.
If you could move to the conclusions, please. We're running a little bit short on time. Sorry.
Great. I'm headed there. So if you look at the outcome variables, we are also observing that forage suitability for grazers is actually impacting positively on milk production and consumption. So our results demonstrate to us that if you improve forage suitability among these areas or in these areas, then you will increase milk production. You will also increase consumption of milk products. And then we are also finding out that forage suitability is an important channel of transmission of drought to the welfare of individuals and the households in the northern and southern Ethiopia. So this affirms a few things. I'll just touch on two, and then I end it there. Early intervention through increased access to livestock feeds will really help in addressing drought risk and improve on nutritional aspects. And another thing that we are also realizing is that if we increase the investment in high-frequency data collection efforts, then we are likely to really benefit fragile contexts, people who are living in areas that are really affected by drought. And these kind of methods are cost-effective as compared to traditional methods like using enumerators to collect information. Thank you very much.
Thank you so much. Thank you so much, Vincent. So let's take a quick pause here. I want to thank the first three presenters. So Annette, Elodie, and Vincent, thank you very much. I think very clear and engaging presentations. I don't know if there are any clarification questions. I see that we only have one question in the chat that hasn't been answered, and it was a question for Vincent about what types of milk the study is considering. Maybe you could answer that briefly, Vincent. And if there are no further questions after Vincent's response, we'll move on to the next three presentations.
Okay, so the milk we are looking at is actually just the milk volumes produced at the household level. That is the milk produced from an index cow that we identify at the start of the study. Yeah.
Okay. And then we have a second clarification question for you, Vincent. It's is the rainfall availability a dummy variable equal to 1 if a respondent reported that it rained or not? Or is it the actual rainfall measured in the sentinel zone?
Okay, a good one. Great. So for rainfall, we are using a subjective assessment. So we are asking the respondent, did it rain in the last 7 days? So it's a yes or no.
Okay. Thank you very much, Vincent. If there are no further questions, and we'll come back to a Q&A at the end, but to save time, I suggest we move on. So thank you again to the first three presenters. So let's move on then to the presentation from Naomi Saville from University College London.
So thanks very much for the opportunity to present today in this exciting session. I'm privileged to be reporting on behalf of a multidisciplinary team from University of Bristol, UCL, Hurd, and London School of Hygiene and Tropical Medicine. And I'd like to, in particular, acknowledge before I get started, my colleagues Tom Timberlake and Sujan Subkoto have done so much of the donkey work to get this study off the ground. So the work that I'm reporting upon is, it's a project called Micropol, where we are measuring the contribution of pollination to diets in climate change impacted areas of the Nepal Himalaya. As you may know, micronutrient deficiencies are highly prevalent in Nepal and throughout low-income settings, but in Nepal there is a particular problem. And what we are finding is that in the context of climate change, indigenous pollinators are being, the populations of these pollinators are being threatened, and this is reducing the production of micronutrient-rich vegetables, legumes, and fruits. And concomitant with that is, as agricultural production falls both due to pollinators and to other effects of climate change on production, we're seeing that consumption of micronutrient poor foods, that's ultra-processed foods like we see here with the chips and the instant noodles, but also highly polished white rice, is increasing. And this is a big problem in terms of access to micronutrients for populations. So to take appropriate action, we need to know what the contribution of pollination is to diets and the status and contribution of pollinators. So we've been doing a study in the district of Jumla up in the northwest of Nepal in the mountainous region of the country. And you can see these are the 10 study sites that we are working in. They range from about 2,300 to 3,000 meters in altitude. And the project has two main components. One is an ecology component and the other is a nutrition component. In the ecology component, what we did was we trained pollination data assistants to collect fortnightly surveys in the 10 villages covering different habitat types to document all the wild and cultivated plants that they could find and all the pollinators that were visiting them. So they've characterized the plant pollinator community. And then as they finished their data collection at the end of the growing season in November 2021, then we started an ongoing piece of work where we are conducting fortnightly quantitative 24-hour dietary recalls. And we're doing this with 726 participants across about nearly 200 households. And so within the households, we're trying to cover adult women, men, adolescent girls, and also children under 5. And some households have all of those groups, some do not. So what have we found out so far? Well, we found that there's a wide range of nutritious pollinator dependent crops in Jumla, the most important of which is this one called the Jumli bean in the middle here. And we've also found that there's a diversity of pollinating insects, which are very important to the pollination of the crops, but honeybees do dominate the visits to crop plants. And this really highlights the vulnerability of crop production to the declines that we're seeing in honeybee populations in the context of climate change. And the other thing we're finding is that different crops vary in the pollinator community that they depend upon. So over here, the apple and the pumpkin are very dependent upon honeybees, whereas over here, the buckwheat and the slipper gourd are more dependent upon flies. So we need a wide diversity of both pollinators and the plants to maintain pollinator services for the production of fruits and vegetables. And what my amazing ecologist colleagues have been able to do is they construct these really interesting network diagrams. And you can see along the bottom here that we've got like just over 250 species of plants. And the ones in red are crop plants, and the ones in black are wild plants. And you can see how, for example, a honeybee may make a lot of visits to, say, a mustard plant here, or to one of the different types of green leafy vegetables or apple, but then they also depend on all these wide range of wild plants which support them. So what it demonstrates is that there's a need for a great deal of diversity, and we need the network of wild plants in order to support the pollination of our crop plants. And this is just an example of some of the wild plants that are needed to support the pollinator community. So as far as our recall of food items is concerned, as this is still an ongoing piece of work, we've not conducted the analysis yet of our recipes. We're still collecting recipes, so we don't have the nutrient content of all the different foods as yet, but we will be analysing that further down the line. But what I've done here is just to look at the frequency of the different food types that we've been able to record over the last 6 months. And this is a recall of nearly 68,000 food items recalled over these fortnightly visits. And what we see is that cereals here account for 44% of the items recalled, and potatoes again account for a large proportion. And then pulses are extremely important, and these are our insect pollinated foods. You can see that animal production, animal food consumption accounts for only about 3% of the foods listed. And if we look at what proportion of the foods are insect pollinated, we found that 96% of the insect pollinated foods were locally grown, so they were dependent upon the local pollinators. And we see that around about 25% of the items listed were insect pollinated foods. And of those, the vast majority were the jumla beans, followed by chilies. And you can see down here in these, for each of the respondent groups, you know, the proportion of fruits and vegetables was very low all over the winter and early spring season. So what we're hoping now is to see a kind of explosion of consumption of the insect pollinated fruits and vegetables as the monsoon season goes on. So here you can see at the end of, when we started the study in November, there was still some consumption of apples and slipper gourds and pumpkins. But then as the winter went on, that consumption goes down, and we're expecting it now to go up again during the monsoon. So what can we do with all of this information? Well, we've already got the diagram of how the pollinators map onto the different food crops. But what we're next going to be able to do by looking at our dietary data is see how the food crops map onto the available of nutrients. And then our ecological modelers are able to then model the effect of climate change, not only on the plant pollinator community, but on the availability of micronutrients in the diet. So in conclusion then, we found so far that insect pollinated foods are crucial to dietary adequacy in remote mountainous areas of Nepal. And we recommend that climate smart agriculture really needs to be combined with managed pollination through beekeeping, but also through habitat conservation and avoidance of agrochemicals to try and promote improve pollination services. We also need to improve dietary choices through social and behavior change communication. And obviously we need to be advocating for climate change mitigation and adaptation now at local, regional and global levels. And just as I end, I'd like to acknowledge the fantastic team with whom I'm working on this project. Thank you very much.
No, thank you so much, Naomi. Very clear presentation. I'm sure we'll have questions on the results in the conversation at the Q&A part. Okay, so let's move on to the next presentation. Christian Reynolds, over to you for your presentation.
Hello, my name is Dr. Christian Reynolds. I'm from the Centre for Food Policy at City University London, but I'm here representing a very wide range of co-authors on this paper in progress, as it were, called Comparison of Greenhouse Gas Databases Using FoodX2 Codes. So, as I said, I'm a member of the Centre for Food Policy. I come from a sustainable, healthy consumption with food waste background, as it were. So I come from food politics, history, mathematical approaches, those sorts of things. But we have a very wide range of co-authors here. And I'll just highlight that the work I'm presenting today, it's an ongoing thing. So we, on the right of the screen, we presented a version of a paper that this is building upon back at the LEAP conference in 2018-2019. And more recently, we had a paper in Frontiers of Artificial Intelligence, which is using some of these things to think about how you could use them. And I'll come to this at the end of this paper. So what is this presentation for these next 7 minutes or thereabouts about? Well, the problem is that in terms of sustainability data, or in terms of greenhouse gas emission data specifically, there are multiple databases, each talking about different production systems. So for instance, if there's a database in the UK, it's about data for production of foods, grain, meat, etc. from the UK. If there's one for the EU, it's typically about the environmental impacts of producing those things in the EU. And there's also global databases. But the problem is each of them only has a certain number of foods, and they're all not harmonized to each other. But these databases have been growing in complexity since the early 2010s. The problem is when you match these databases to a nutritional database, e.g. to be able to understand the dietary footprint, so understanding the environmental impacts of someone's diet, that takes time because you have to individually match each item in a greenhouse gas database to a specific food or multiple foods. So it can be one-to-many or many-to-one relationships within that. However, we were discussing as a community of practice saying, how about we use some standardized linguistic databases or linguistic codes that exist to match dietary databases already? And one of these is called FoodX2. And our big question in this paper is, could we use a dietary classification system to match lots of different sorts of greenhouse gas databases to different sorts of nutritional data? And if we do that, what is the reliability of linking via a pre-existing nutritional classification system by comparing different greenhouse gas databases? So we're basically, in this paper, we're mapping different greenhouse gas databases to an existing hierarchy of nutritional information, and then seeing what happens from there. So firstly, what is FoodX2? Well, FoodX2 is a comprehensive food classification and description system developed by the European Food Safety Authority. It's used and has been matched to all the different EU harmonizers, but it is a clear hierarchical structure, which means that each food eaten, and it's based on the EU diet, of course, but is now a globally relevant hierarchy, fits inside one group. So there's 21 first rank or first part of the pyramid groups within the different matrix, and then they go down into different generic, non-specific, core terms, etc. And so in total, there's over 4,500 FoodX2 codes. And you can see at the top of the screen on the right-hand side, you can see here how there's a category which is called grains, which goes down to leavened bread, which goes to white bread, and then say even rye bread. And then inside there, there's wholemeal rye and then rye flour. This is the same for all these different sorts of categories. And the beauty is that the FoodX2 classification system has been adopted by the Global Dietary Database. So this is an example of the FoodX2 classification system at work in terms of thinking about a product. Each of the different items on screen has a specific numbered code. So A07SE is a facet for organic production, while for yogurt, cow-flavored milk, that's A02NH. So there's specific things that you can see inside a hierarchy. There's no double counting. However, FoodX2 is now being linked to multiple different dietary data sets. So the FAO WHO GIFT has 33 countries of data mapped to Food X2 classification. Likewise, the European Food Safety Database of food consumption has 21 European countries. And at the Global Dietary Database, there's 407 nutritional data sets there with some level of Food X2 mapping. So this means that if we figure out if this mapping works, we can provide environmental impacts for all of these databases like that, which is a really unique and powerful thing instead of having to do each coding individually. So what we did was we at City University with our colleagues said, let's take one of the big databases, which is called Nemechek. And it was published in 2018. It wasn't the first to do this, but what it did was do a meta-analysis of 43 different food categories. And it basically therefore found the average global mean value for CO2 emissions, for land use, for multiple things. The positive of the Nemechek is it gave the 5% and 95% confidence intervals for each of these, which means other databases could be compared to see if they fitted inside this 5 to 95% range. So you can see here on the slide, you can see the 5 and the 95% confidence intervals, as well as the mean value. So you can see there's a wide spread of global production impacts according to greenhouse gas emissions. And what we did was we hand matched these 43 food categories to all 4,500 food categories within Food X2. So you can see here on the bottom of the screen that the Food X2 values were matched. So barley and similar were matched to beer and barley in Food X2, cereals and grains was matched to rye and wheat, etc., etc. So we didn't just do this, so we did this for Nemechek, and that's what we're going to refer to in the next couple of slides as the city database. It was multiple authors, but there we go. So that was 43 food categories matched to 4,500. However, other people have started doing this as well. So the Sharp database took 945 food categories matched to Food X2. Rose and Heller have matched 608 categories to Food X2 or to the USDA database, which was then mapped to Food X2. And Josefa Garzillo and colleagues in Brazil have mapped their database to 329, which means our database, the full one, can be compared and we can look at those correlations in comparison. And so that's what I would like to present for the last few minutes of this presentation. So you can see here our database compared to others in terms of correlation. You can see that the Sharp database has the strongest correlation values there with a correlation of 0.69 compared to Garzillo with 0.61 and Rosenheller 5.7. But all of them have some similarities throughout, showing some different magnitudes here. And again, I'll let you explore this with online. I've got 30 seconds left, I think. So what I'm going to just be highlighting here is their complexities throughout this, but they're all correlated in the same way, which is good news. The really interesting thing for me, and this is what I'll leave on, I have 1/2 more slides, don't worry, is that majority, 44% of things were within the 5 and 95% confidence intervals. But there are specific values in each database that are not within that. And some are lower, some are higher. And what this means when you actually get down to it is that there are 4 different cases. It could be that one is much more bigger magnitude. So within the city, beef is a much bigger carbon footprint, leading to a much bigger carbon footprint of the recipe. However, within other ones, such as Victoria Sandwich, butter is much bigger in the Sharp footprint database than the city footprint database, leading to a bigger carbon footprint if you look at that. But you also have examples of, say, broccoli salad or here, where they're actually very, very close still. So we need to continue to look at this further, but that's really exciting because potentially we can now have environmental impacts for, 30 to 40 greenhouse gas different dietary databases like that. I'll leave it there and look forward to questions.
Thank you so much, Christian. I think that's a very clear presentation, very interesting set of work. Okay, let's move on then to the final presentation of this session, which will be Lilia. So Lilia, over to you.
So thank you everyone for joining us. On behalf of my co-authors, I present our work on pesticide exposure and child growth in low and middle income countries. This is a systematic review we recently completed. As way of background, pesticides are widely used in agriculture and residential settings globally. And there's a lot of evidence, primarily from high-income countries and settings, that show that prenatal exposure to organochlorines is associated with adverse birth outcomes, whereas prenatal exposure to organophosphates is not. With respect to birth length and birth weight, evidence is less consistent, with some types of pesticides and groups of pesticides associated with poorer outcomes and some of them not. However, evidence from low and middle income countries is much more limited and has not been previously synthesized. So our objective here was to systematically review and synthesize the evidence on the associations between pesticide exposures and child growth in children less than 5 years of age living in low and middle income countries. So we searched 10 electronic databases from inception until the end of November last year without any language restrictions. And 2 researchers independently screened studies using Covidence, extracted data, and assessed the certainty of the evidence. We included studies conducted in a low and middle income country based on the World Bank classification of the country at the time the study was conducted, studies that assessed children less than 5 years of age, and which evaluated a self-reported or measured prenatal or postnatal exposure to pesticides. And we considered any time during pregnancy for the prenatal exposure. And we considered studies that measured at least one anthropometric measure of child linear or ponderal growth. That's, for example, length for age Z-score, and one of 6 birth outcomes. So birth length, birth weight, low birth weight, preterm birth, small or large for gestational age. We excluded studies from high-income countries, again, based on the World Bank classifications. Studies assessing children older than 5 years of age. We excluded studies of particular designs, such as animal studies, case controls, other systematic reviews, and so forth. And we also excluded studies focusing on insecticide-treated bed nets that focused entirely on malaria prevention. In terms of data analysis, we summarized the data narratively by outcome and pesticide type. And we summarized evidence on adjusted outcomes the way they were reported by the authors. Due to the heterogeneity of the studies that we identified, we were not able to conduct a meta-analysis, and we weren't always able to convert the auto-reported effect measures to standardized measures. And we assessed the quality of the evidence and the risk of bias using the GRADE approach. Moving on to results. We identified a total of 939 records, which, after removing duplicates, screening studies based on abstracts and titles review, and based on our inclusion and exclusion criteria, we ended up with 31 articles that were included in this systematic review. In terms of study locations, we had 16 countries, which you can see here in reverse alphabetical order. And I have plotted the number of studies. The highest representation was from China with 11 studies, followed by Argentina, Mexico, and Poland. All studies were published between 2003 and 2022. In terms of designs, we had only observational studies, so 11 prospective cohorts and 20 cross-sectional studies. In terms of how exposure was assessed, on the left-hand side, you can see that 23 studies assessed biomarkers and 8 studies used self-reported measures based on questionnaires. And on the right-hand side in the pie chart, you can see that from the studies that assessed biomarkers, about half of them used blood samples, 8 used urine samples, 2 used breast milk, and 2 used placenta samples. The types of pesticides that were assessed were, again, in reverse order of the most frequently assessed to the least frequently assessed. Most studies, 17 assessed organochlorines, followed by organophosphates, pyrethroids, carbamates, and 4 studies that used self-assessed self-reported measures did not specify the types of studies. They relied on questions like, were you exposed to pesticides in the past year, for example? And all of these studies that we included assessed pesticides prenatally. In terms of outcomes that were assessed, these are, you can see here all the different outcomes. For the presentation, I'll focus on the top 4 that was most frequently reported. Birth weight was reported in 24 studies. Birth length was reported in 15 studies. Low birth weight, defined as birth weight less than 2,500 grams, was reported in 9 studies. And preterm birth, defined as birth before 37 weeks of gestation, was reported in 6 studies. We have kind of 2 key findings that I wanted to present here today. One is that we find mixed associations between prenatal pesticide exposure and birth weight and length. So exposure to organophosphates, organochlorines, pyrethroids, or carbamates had mixed associations with both outcomes. That is to say that some studies showed that these pesticides are positively associated with birth weight and length. Some showed that they were negatively associated, and some studies found null associations. Our second key finding is that exposure to some pesticides, specifically some organophosphates and some carbamates, may be associated with increased risk of low birth weight and preterm birth. A major kind of contribution of the systematic review is kind of identifying some of the key limitations of the literature when it comes specifically to low and middle income countries. Most of the studies we included were at serious risk of bias, and the certainty of the evidence was graded as very low for all of the outcomes I just presented. Among the key limitations is that many of the studies had incomplete toxicology picture. That is to say that they only looked at a handful, like 5 or 6 biomarkers. They assessed exposure at a single time point during pregnancy, so we couldn't draw any conclusions or learn anything about more chronic exposures. We identified no studies from Sub-Saharan Africa, Central America, the Caribbean, or Asia Pacific. The majority of the studies had very small sample sizes, as few as 50, for example, and often participants were recruited as a single location. So, for example, a single hospital. Most studies did not conduct subgroup analyses, apart from looking at differences by child age and sex. And again, findings were quite mixed there. And given that all the studies we included were observational studies, we can't really talk about causal impacts of pesticide exposure on child outcomes. These are really associations between exposures during pregnancy and birth outcomes. So in conclusion, we find these mixed associations between prenatal exposure to pesticides and child growth among children less than 5 years of age. We discuss many implications for research and practice in the manuscript that hopefully will be out soon. But it is kind of obvious that we do need more studies with more complete toxicology pictures and studies that do focus on pesticides that are frequently used in the countries and the settings where these studies are conducted, and are assessing exposure over a larger window, more acute exposures, more chronic exposures, further into childhood, and kind of creating a better picture and better understanding how pesticides are associated and how they influence child growth. As a last slide, I'd like to acknowledge funding from the UKRI Medical Research Council and the DBT Wellcome Trust India Alliance Fellowship. Thank you so much.
Okay, Lily, thank you. Thank you so much. So I think we've come to the conclusion of our 6 presentations. I want to thank all of the presenters tremendously for their efforts and their very clear and I think interesting presentations that we've heard today. So what I see here in the chat, the first question I have is for Naomi. And there's a question here about when collecting data on plant pollinator communities, did you take note of surrounding land use types? For example, distance to natural habitat, percentage of human altered land uses in the surrounding landscape, etc. So maybe you've already started to answer this in the chat, but if you want to answer it verbally as well, Naomi, please go ahead.
Thanks very much. Yeah. What we did was to Tom Timberlake used Google Maps, first of all, to categorize all the land around our villages to put them into 3 categories. We had cropland, village environment, and then sort of natural environment around the cultivated land. So we had those 3 categories, and then the locations were kind of randomly selected from those 3 categories to try and make sure that we covered all the different ecological niches of the pollinators. But we had a few challenges because, you know, sometimes where he had randomly selected was right on the edge of a cliff, because these are very, very steep areas. So then the data collectors had to kind of go to the nearest place to that if it was like a very treacherous place. But that was how we covered the different habitat types.
And there's a second question here for you as well, Naomi, just on information regarding the dietary data collection, if you could provide just a quick overview of how you went about that.
Sure. So what we've done in this study, which is different from what we've done before in Nepal, is we're using food models for every single food, unless it's like a whole apple or something. So the data collectors have a big pot of colored rice, which they take to the field with them, and some roti dough, some dough ready mixed for making chapatis or whatever. And then when the respondent asks, it says that they ate a particular food, then the data collector dishes out on a weighing scale and asks the respondent to tell them when to stop, and they show the amount that was eaten. So we're using these food models, and then what we're doing is collecting recipes for each of the different food types, and then we're able to calculate the nutrient content of each recipe, and then we'll merge that in with the food models, and we collecting conversion factors as well. So it's a very meticulous piece of work. It takes a lot of time.
Yeah, that sounds quite meticulous. So thank you for explaining. Christian, we have a question for you. Basically, one of the participants would like to know the manual match made between, if the manual match made between the data set is currently available, or if it will be made public, and how the different methods used to calculate greenhouse gas emissions would affect the results.
Thank you very much for the question. It will be made public once with the publication that we're doing of this. So we're doing a little bit more detail than this. We've now got 5 greenhouse gas databases rather than 3 we're comparing for the full publication, but our own method will be made public. And so that way it can be used by the wider community. And yeah, the variability between those. But I recognize we have a limited time, and please do get in contact if you're interested. I'm happy to talk further. I
think if you want to just speak a bit briefly about how the different methods relate to the greenhouse gas calculations, that's probably fine.
Okay, for the 10-second top line is, because of the different assumptions made in the creation of the greenhouse gas databases, there are fundamental differences in them. But again, as I showed on that last slide, which I ripped through pretty quickly, there are specific food items in diets that are causing higher amounts of greenhouse gas. And I think the big take homes are that animal-based proteins, the level of impact outweighs anything, and also fats. And I think the most interesting thing from a nutritional perspective is your fat can be less than 5% of the mass of your diet. Yes, it can have up to 70% almost of the greenhouse gas impact if you're on a vegan or vegetarian diet. And so thinking about butter versus an oil type, a vegetable oil type, can have a major difference for a small amount of weight if we're thinking about diaries in any country. So we've got a database here looking at French impacts, and the French love their butter, and you can definitely see that impact changes depending on the dietary database, the CO2 database you use.
That's tremendously interesting. Thank you, Christian. So if there are no further questions, I would just like again to thank the presenters for some great work, and I hope you have a wonderful rest of the day, evening, or whatever time you may be.
Thanks to Mark as well for brilliant chairing, and to all our fantastic presenters. We really enjoyed your presentations, and just a huge thanks, of course, to our participants. Thank you so much, everyone. Enjoy your day.